attacks and heart failure are among the most common causes of hospitalization and readmission. Arnot Health's Heart Clinic team works with patients to inform, treat, and manage these complex conditions.
So everyone's on the same page. The patients are aware what medications they can take, they should take, and we make close progress to make sure they're getting better, which really prevents them from coming back in the hospital multiple times and reduces their chance of dying from their heart problem over time.
Especially when working with patients who will need to keep everything under control for decades to come.
The age range is sometimes down to 20s all the way up to 80s, 90s, so there is a big range.
By checking in with patients, making sure they're compliant with medications, eating a well-balanced diet, maintaining and controlling blood pressure, the team can help keep them out of the hospital.
We have seen patients who have come out of the program who are back to their normal lifestyle.
Patients know what signs to look out for and what to do if they notice any red flags.
They're given instructions on, if they're in a yellow zone or a red zone, they need to give us a call.
Heart failure zones are used to track symptoms and indicate when medical intervention is needed.
In the green zone is you're doing great, you're not gaining weight, your breathing's fine, no changes, perfect. Yellow zone is we have maybe gained a pound or two in a day or more than 5 pounds in a week. I'm noticing my shortness of breath is getting worse. That's your time. You got to call us. Don't wait, because it's only going to progress to something farther, and we want to prevent people having to go into the hospital. Red zone is we're in trouble. I got to call someone now, or I got to get to the emergency department.
With issues of reoccurring readmission, confusion over what medications they were taking, and a general lack of understanding of their condition,
We knew that there was a huge need for someone to be able to take the extra time during visits, weekly phone calls.
patients' appointments are scheduled for an hour at a time, spent getting to know them as a person, what their lifestyle is like, and making sure they leave with all the appropriate tools.
I think in order to help these patients, you have to look at the whole picture. It's not just, oh, I had a heart attack, here's your medications, see you later. Especially nowadays, there's a lot of factors that come into play.
Angela says most of her patients have her work phone number.
We want to make sure that they know that we care and we are here to help them 100%.
In a time where life, personally or professionally, is go, go, go all the time, it may seem impossible to find the space for self-care.
But at the end of the day, you have family members that care about you. There's somebody that loves you. You have to think about yourself.
Because surviving a heart attack or living with heart failure is not the end.
You can live a completely normal life with a reduced ejection fraction, as long as you're doing what you need to do to keep your body healthy.
If you have questions about the Heart Attack and Heart Failure Clinic, call 607-737-4130. For Arnot Health, I'm Lexi Cutmore.